Do you know that it's not every positive pregnancy ends to the birth of a baby? Some pregnancies end unexpectedly through a condition known as miscarriage. And today I'll be discussing miscarriage, the causes, the signs and symptoms, and then probably the management. So let's get started. What is a miscarriage? A miscarriage, also known as a spontaneous abortion, is the loss of a pregnancy before 20 weeks of gestation. And this is a common complications of a pregnancy, affecting about 10 to 20 known pregnancies. And then most of these abortions, most of these miscarriages occurs in the first trimester. Now let's talk about the difference between a miscarriage and an abortion. There's not much big differences between these two, only that a miscarriage is the a medical term for an abortion, and this is the natural unintentional loss of a pregnancy, whereas an abortion is a termination of a pregnancy. In this case, it can actually be a deliberate or a non-deliberate act. Let's talk about the causes of a miscarriage. Let's talk about the causes of this abortion. Here we have chromosomal abnormalities. This is where we have either a missing chromosome, an extra chromosome, and in some cases we also have genetic factors which does not allow for the normal development of this fetus. Talking about the missing chromosome, normally as a human we all have 46 chromosomes, 23 from each parent, but in a condition whereby this fetus is having 45 instead of having 46, this can actually be a cause of a miscarriage. Then talking about the extra chromosome, this is a condition whereby this fetus, instead of having 46, is having 47, and this can equally be a cause of a miscarriage. Then we talked about the genetic factors such as the trisomy 13, trisomy 18, which actually might not allow for the normal development of this fetus. Then we also have causes like the maternal health conditions. Here the mother is having a chronic medical condition such as kidney diseases, thyroid diseases, severe hypertension, uncontrolled diabetes, autoimmune disorders, and so on and so forth. Then we have some infections such as malaria, syphilis, HIV, and so on and so forth. We also have causes like the uterine and cervix problems. This is where we have the congenital abnormalities of the uterus, and then we have cervical problems such as an incompetent cervix or weak cervix. Cervix in a layman's understanding is the mat of the uterus. So in cases where this the mat of the uterus is too weak to hold this cervix, it can easily open up and then allow the fetus to expel. Then we have hormonal problems. This is where we have the low production of progesterone. Progesterone is the hormone that maintains pregnancy. So when there is a low production of this hormone, it can lead to a miscarriage. Now we also have causes like the advanced maternal age. This is where the mother is above 35, and to aging up to 40 and above can increase the risk of this condition. Then let's talk about the types of this condition. Let's talk about the types of abortion, the types of miscarriage. Here we have a threatened abortion. As the name implies, there is a threat to this pregnancy, but in cases this pregnancy might end up continuing, and then in this condition the cervix is closed, but there might actually be a vaginal bleeding, and then bed rest is usually suggested in this type of situation. Then we have something called the inevitable abortion. Also, as the name implies, inevitable, something beyond control. This is where the pregnancy loss is beyond control. This is where there is a loss of the pregnancy. There might be vaginal bleeding, there is abdominal cramps, the cervix is open. Then we have something called the incomplete abortion. This is where the fetus is gone, but there are some remnants of the parts, there are remnants of the body still remaining in the uterus. And then in these cases there is also an abdominal cramps, there is pain, the cervix is open, and so on and so forth. Then we have what is called the complete abortion. This is where all the remnants of the fetal parts are all gone, and then in these cases the bleeding will actually take time to reduce it. Then we also have something called the missed abortion. This is where the fetus is dead and is still remaining in the uterus, and then initially there might be no symptoms. We also have something called the septic abortion. The septic abortion is the type that occurs as a result of the complications of infections. Then let's talk about the signs and symptoms of this condition. Here we have a passage of tissues. The tissues meant here is the part of the fetus. It is the remnants of the fetus. Then we have passage of this tissue from the vagina. We have passage of the blood clots from the vagina. We might also have something like the abdominal pain, cramp, back pain, pelvic pain, nausea, breast tenderness, dizziness, and then so on and so forth. Now let's talk about the diagnosis of this condition. It's being diagnosed through a medical history and then physical examination. This is where the health care provider take history, take notes of the previous the previous miscarriages in the past, and then assesses some of these tissues and some of these clots being passed from the vagina. Now let's talk about the risk factors of this condition. Which categories of women are so prone to having this condition? Number one is women who are above 35 years of age. Number two is women who might have had previous miscarriages in the past. Then we have women who are so exposed to some certain kinds of chemical, women who smoke, excessive use of alcohol, and then also women who are so obese. Now let's talk about the investigations of this condition. This condition can be investigated through a complete blood count, through a pregnancy test, through ultrasound scan, and so on and so forth. Now let's talk about the management of this condition. Number one is here where we have the expectant management. This is where the body is allowed on its own, on its natural own, to expel the remnants of this body parts. And then we also have some medicines which can also help to flush out the remnants. We also have treatments like the surgeries. Here we have the D&C, which is the dilatation and the curettage, and then the vacuum aspiration. Now let's move over to the emotional impacts of this condition. We have some emotional impacts such as sadness, depression, anxiety, feeling of guilt, grief, and then so on. Let's talk about the prevention of this condition. Actually, some causes of this condition, which are mostly causes as a result of chromosomal abnormalities, cannot be prevented, but the risk can be reduced by either cessation of smoking, cessation of excessive use of alcohol, maintaining a normal weight gain, taking of folic acid before and after pregnancy, attending a regular antenatal visit. Let's talk about the complications of this condition. Here we have short-term complication and we have long-term complication. Talking about the short-term, this is where we have severe bleeding, we have infections, and we have shock. And shock is as a result of the severe bleeding. Then talking about the long-term, this is where we have emotional distress, we have anxieties about future pregnancies, and then there might be infertility in some cases. Now let's move over to the misconception. Let's move over to the some people believe that miscarriage is caused by exercises. This is false. There are exercises such as the Kegel exercises, swimming, and walking, which are good for pregnancies. Where some others also believe that having a miscarriage means that you'll become fertile, but that is not true. Some women can actually go on and carrying a pregnancy to term, and others believe that miscarriages can also be caused by stresses, but that's not also true. A day-to-day stress, a daily stress cannot totally be a cause of a miscarriage. In conclusion, I would say that a miscarriage is a common complication of pregnancy, although most of these miscarriages are caused by chromosomal abnormalities, but there are other features such as the maternal health, infections, and service problems, which can also be a cause of this condition. And a proper care and counseling can actually help a woman carry a pregnancy to term. And I have come to the end of this video. If you find this video helpful, don't forget to like, share, and comment, and don't also forget to follow Nurse Anita for more health detailed explanation. Bye for now.